Okay, sir, start.
Hello everybody, I am Dr. GN Ramesh. I am a medical gastroenterologist working as a senior consultant at the Aster MedCity Kochi. I bring you greetings on the occasion of World Hepatitis Awareness Day, which we observe on the 28th of July. The theme this year is "We can't wait for a world without hepatitis." I would like to go through a few do's and don'ts as far as hepatitis is concerned. We all know that hepatitis refers to inflammation of the liver, and this inflammation can either be because of infection with viruses, or it could be because of injury to the liver in any form. The commonest is alcohol. A WHO study found that an estimated 4.5 million premature deaths could be prevented in low and middle income countries by 2030. And this could be done through vaccination, through proper and appropriate diagnostic tests, through medications, as well as education and awareness. 90% of the mortality is caused by only two types of viruses, hepatitis B and hepatitis C. Let us go through the four major viruses that can infect the liver. Hepatitis A is an infection that is transmitted through the fecal-oral route. It is caused by viruses through close personal contact with an infected person, or through eating or drinking contaminated food or drink. Normally, a person with hepatitis A would have fever, fatigue, nausea, sometimes stomach pain, and later on jaundice. We call this prodrome followed by jaundice. The treatment involves just observation, rest, proper hygiene and care, and the family members need not be worried about the fact that they would get the infection, because the infection is usually what we call as self-limiting. Hepatitis B is transmitted through sexual contact with an infected person, through sharing of needles, syringes, and other drug injection equipments. It could also be transmitted to a child during or soon after pregnancy. Normally, a person who has got an hepatitis B would either be free of any symptoms, or if at all they have symptoms, it is very mild in the form of fatigue, poor appetite, or sometimes stomach pain and nausea. The treatment, we have antiviral drugs to be used in some situations, but prevention is the best form of cure, and hepatitis vaccination is what we advise to everyone across the population. Hepatitis C is also transmitted almost in a similar manner, but mainly through sharing of needles or other equipments used to prepare and inject drugs. It is seen quite commonly in dialysis units. It is also seen commonly in areas where people live in close contact. They usually don't have any symptoms, and very often hepatitis C is picked up in its chronic phase, and the acute phase is usually missed. We do not have any vaccine, but we have very good drugs to treat hepatitis C. Hepatitis D happens only when a person has got hepatitis B, which means that it will not infect a person who does not have hepatitis B. The symptoms are usually, sometimes it could be a serious illness, or sometimes it could be a self-limited illness also. The key to treatment is prevention of hepatitis B through vaccination, and once we have taken care of hepatitis B, hepatitis D automatically gets controlled. Hepatitis E, the fifth of these viruses, behaves just like hepatitis A, meaning thereby that the transmission is through infected water or food, and it happens in epidemic forms also. That means you could have a lot of cases in the community, in a closed community as well. The common symptoms are just like hepatitis A, where there is a significant prodrome followed by jaundice, and it is particularly dangerous when it happens in pregnant women. There are no specific treatments. What is to be noted is that the symptoms of all types of viral hepatitis are similar and can include jaundice, fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, joint pains. And they usually report dark colored or high colored urine, and sometimes clay colored stools, which is pale stools. So I will then now come to a few do's and don'ts. First of all, the do's: take sufficient rest, eat a well-balanced diet which is low in fat, rich in fruits and vegetables, drink about 6 to 8 glasses of water every day, avoid tobacco, avoid any form of drugs except those under medical supervision. We must all wash our hands diligently with soap and especially after visiting the washroom. Cover open wounds, sores or cuts with a bandage. Discard used items carefully to prevent accidental exposure to someone who is unsuspecting. Get vaccinated, especially with reference to hepatitis B and hepatitis A. Get tested for hepatitis during pregnancy, and the most important is practice safety hygiene to avoid sexual transmission. What you must not do is that don't use any personal items of the infected person. So if you have an infected person at home, it would be better to have their toothbrush, toothpaste, tongue cleaners, shaving razors should be kept isolated. So don't share razors, toothbrushes, or syringes or needles. Don't donate blood or breastfeed your baby if you are infected. No alcohol of any form. Avoid traveling in an infected condition, and also avoid poor sanitation areas. Medicines like paracetamol or acetaminophen should not be taken unless it is prescribed, and also over-the-counter drugs or alternative medications, I would advise that you should be very careful. Don't eat, drink contaminated food or water. These simple tips, the do's and don'ts, should ensure that you are protected against hepatitis, and even if you get hepatitis, you will recover from hepatitis. Once again, I bring you warm greetings and re-emphasize that the theme this year, we can't wait for a world without hepatitis. Thank you very much for your patient hearing.